Hello friends, so today we are going to study about the classification of nerve fibers. So let's start. Yesterday we have studied about the neuron and the structure of it along with its function. So we discussed the structure of the nerve also in detail, and the nerve fiber which is in the nerve. So we are going to discuss the classification of it today, right? So, if we are talking about the classification of nerve fibers, it is based or it is divided according to the many ways, right? We will see that the first one is your it depending upon your structure, means depending upon the structure of the nerve fiber, it will divide into the two parts, right? It is myelinated and non-myelinated, right? And I'll tell you in detail. First of all, let me just write it that what are the classifications and how it is based on what type. See, first is depending upon the structure, and second one is your depending upon the distribution, right? So if you're talking about the distribution of the nerve fibers, then it will again divide into the two parts, that is your somatic and your visceral, right? So if you're talking about the third part, that will depending upon the origin, right? So if we talk about the origin, that how it is based, that will also again classified into the two parts, that is your cranial nerves and your spinal nerves, right? So if we're talking about the fourth type, that is depending upon the function. So then also it will be again classified into the two types, that is your sensory, right, and your motor. And the fifth type is depending upon the secretion of neurotransmitter, that the nerve fibers that depends upon the secretion of which type of neurotransmitter, means they secrete from the nerve endings. We will study it in detail. First let's see the classification. So then again it will classify into two types, that is your adrenergic and your cholinergic, right? And the last one is depending upon the diameter and conduction of velocity or conduction of the impulse. right? This I'll tell you. They are divided into the three parts. That is your type A fibers, type B fibers, and type C fibers. And if I see that type A is again classified into alpha, beta, your gamma, and your delta, right? Now let's see one by one what are they. See, we are talking about today that the classification of nerve fibers, that how the nerve fibers are classified. So, if we see, we have seen that it is classified into the six types depending upon the different things, right? If we talk about the depending upon the structure, it will divide into myelinated and non-myelinated. If we talk about the depending upon the distribution, it will divide into the somatic and visceral. If we divide on the basis of the origin, then it will be cranial and spinal. And if we divide on the basis of function, then it will be sensory and motor. And if we divide on the basis of your secretion of neurotransmitter, then it will be your adrenergic and cholinergic. And depending upon the diameter and conduction of velocity of impulse, it would be your three fibers, your type A fibers, type B fibers, and type C fibers. And then we have type A. We have the many subtypes of it, that is type A alpha fibers, type A beta fibers, type A gamma fibers, and type A delta fibers, right? Now let's see one by one that how it is and what why they are grouped under these categories, right? Now if you see the first one, see here, wait, let me take the new pen. See, depending upon the structure, right, it will be divided into your myelinated and your non-myelinated. If you see here myelinated and non-myelinated, what does it means? It means that we have studied the neuron yesterday, right? It is the same neuron. Let me show you by drawing it, right? See, for example, this is the neuron, right? If it is not clear to you that how it is made and what is the structure of it and what is the function of it, you can go to my previous video and check there, right? See, we have discussed the classification based upon the structure, that is your myelinated and non-myelinated. First of all, let me draw this also. Wait a minute, then it will be more clear to you, right? See, this is for example your diagram A and this is your diagram B, right? These are both the neurons, right? And what is the difference for which I can say? If you notice here, here your myelin sheath is not present, means that covers your axon like this, right? Likewise, here it is present, right? So the neurons which are devoid or where the myelin sheath is absent, they are called your non-myelinated nerve fibers, like this neuron. So it will be called your non-myelinated nerve fibers. Why? Because it is devoid or it is the in the neuron the absent of the myelin sheath is there from the in the axon, right? So if there is no myelin sheath, So these that type of neurons are called your non-myelinated nerve fiber. Simple, depending upon the structure. And if we see in this neuron in the structure B, we have the myelin sheath here. This one is your myelin sheath, right, which is on the axon. So if the myelin sheath is present on the neuron, then the neuron will be called your myelinated nerve fiber. Simple, right? This classification is clear, which is depending upon the structure. Clear? So now if we see depending upon the distribution, the second classification, it is somatic and visceral. It is also very simple. See, the nerves or the neurons which are supplying your skeletal muscles. Simple. They supply your skeletal muscles. The nerves or neurons which supply your skeletal muscles, they are called your somatic nerves, right? And if they are means distribution, distribution where it supplies, that is why they told the distribution means where they are distributed. So depending upon the distribution, the nerve fibers are divided into two parts, that is your somatic and your visceral. Means somatic means the nerve fibers which are distributed or which supplies to the skeletal muscles, your voluntary muscles, right? And if we talk about the visceral, here we can see the nerve fibers which supply to your internal organs, means your involuntary system, right? The nerve fibers which supply to your internal organs, that fibers are called your visceral fibers. Simple. So they have classified it under the depending upon the distribution. Fine. So far we have studied the two classification. One is depending upon the structure, another one is depending upon the distribution. Depending upon the structure, it's clear to everyone that it is where the neurons which are devoid of the myelin sheath or where the myelin sheath is absent, they are called your non-myelinated nerve fibers. And the neurons which has the myelin sheath, they are called your myelinated nerve fibers. And if we talk about the distribution, we have again the two types, your somatic nerve fibers and your visceral nerve fiber. In your somatic nerve fibers, that is supplying your skeletal muscles, and in the visceral nerve fibers, that is supplying your internal organs, right? And the third distribution, if I talk about, it is depending upon the origin. What does it means? Means from where the origin occurs of the nerve fibers, right? So they told you depending upon the origin. If we see, we again have the two distribution, that is cranial nerves and your spinal nerves. What does it means? Means, for example, the neurons which are in the brain, right? The neurons which are in the brain, so they are the nerves which are supplying the brain parts of the brain or to the brain structure, that is called your cranial nerves, right? And the nerves which are supplying to the spinal cord area or arising from the spinal cord area, so they are called your spinal nerves. Fine. So if I have to write here, what would be I writing? That the nerves which arise from the brain, right? So they are, let me write it clearly so that you can make your notes. Actually my handwriting is very poor, but I try to improve it for you people. So depending upon the origin, cranial nerves and spinal nerves which arise from the brain, so they are called your cranial nerves, right? And the spinal nerves are what? The nerves which arise from your spinal cord, they are called your spinal nerves. Simple, means origin. They are talking about the origin from where the nerve starts, right? So the nerve or the neurons that arise from the brain, they are called your cranial nerves, and the nerves which arise from the or the neurons which arise from the spinal part, they are called your spinal nerves. Fine. So this is the classification which depends upon the origin. If we talk about the fourth classification, that is the depending upon the function. If I see that depending upon the function means what is the function of it. So far we have discussed the three classification depending upon the structure, its distribution, and its what its origin. See, for example, if I talk about the structure, means how they are formed, right? So either they are myelinated or they are non-myelinated. So that is why they are classified under the structure myelinated or non-myelinated. And if we talk about the origin, means from where they arise. So they are either in the brain or in the spinal cord, right? So either it would be cranial or it would be spinal. Simple. So if it I talk about the distribution, means where it supplies. So if it supplies the skeletal muscles, it would be somatic, and if it supplies the visceral organs or to your internal organs, your viscera, then it will be your visceral, right? Now the fourth one is depending upon the function. So if we talk about the depending upon the function, let me show you in a slide. See, it is sensory and motor, right? Now why they have write the function? Because they are now performing the function only. Means sensation is also your function, means it taking the sensation from the parts of the body, and motor is also the function, means it is doing your movement, right? So depending upon the function, they are classified into two parts, that is your sensory and motor. Now we will see that how. See, for example, this is a human, right? And when the sensation is taking place, right? So let me draw it with another pen. See, when the sensations are taking, so sensations are from where the sensations are taking place, or from where the sensations are pick up to the brain from different parts of the body. Simple. So if the sensations are taken from the upper limb, either from the lower limb, right, and they are going upwards and processed in the brain, right? So these are called your sensory neurons. This is also taking through the help of neuron, na, or the nerve fibers, right? Your nerve fibers or your neuron only taking the information from different parts of the body to the brain, right? So the neurons, or let me write neurons or the nerve fibers which takes the sensation from different parts of the body to the brain, right? So the neurons or the nerve fibers which takes the sensation from different parts of the body to the brain, so they are called your sensory neurons or your sensory nerves. Fine. Now if I talk about the motor, wait. Right. If I talk about the motor, so when the process is occurring in the brain and brain sends a message to the different parts of the body, means through to the effectors, your muscle either or your gland, right? So take this pen. When the brain sends its impulses to different parts of the body, let me take another pen so it will be more clear. So when the brain is sending the impulses to different parts of the body or to your effectors, then the neurons which are taking the information from the brain to the different parts of the body, right? They are called your motor neurons or your motor nerve fibers. Simple. So what would be the definition? You not need have to learn anything. If you memorize, if you understand it, you can write it yourself, right? Neuro is very easy. The neurons or the nerve fiber which takes the information. Now it's not sensation, because it takes the information from the brain, that what message brain computes and it sends to the body, right? Takes the information from the brain, right, to different parts of the body. So they are called your motor nerve fibers. Simple. Is it clear now? The sensory nerve fibers are the neurons or the nerve fibers which takes the sensation from different parts of the body and send it to the brain. And the motor nerve fibers, whereas, are the neurons or the nerve fibers which takes the information from the brain to the different parts of the body, right? So this is your fourth classification. And if we talk about your fifth classification, that is depending upon the secretion of the neurotransmitter, right? Then it is your adrenergic and cholinergic. Let me tell you, let me make you understand with the help of this diagram only, right? If we see, these are your nerve endings, right? From here your new neuron starts, if you know, right? And it will send its impulse, this neuron will send its impulses to this neuron for the further transmission of impulse, right? And for the transmission you require a neurotransmitter here in the synapses, right? And the neurotransmitter is released by your these nerve endings only. Fine. So the classification which is based upon the secretion of the neurotransmitter is, means the neurons which secrete your noradrenaline. This is your neurotransmitter only, right? For example, this neuron releases your acetylcholine. Acetylcholine is also a neurotransmitter, and we are writing it with the ACH, right? Acetylcholine. So, if the this neuron is releasing the noradrenaline, right? This is a neurotransmitter. If this neuron is releasing the noradrenaline neurotransmitter in its synaptic from the synaptic vesicle, then this neuron is called adrenergic neuron. Wait, I have written the wrong spelling. It would be adrenergic, right? And for example, if the neuron is releasing the transmitter which is acetylcholine in the synaptic from the synaptic vesicle, right? If the neuron is releasing the neurotransmitter acetylcholine from the synaptic vesicle, then that neuron would be called your cholinergic neurotransmitter or cholinergic nerve fiber or neuron, right? It's simple. You now know the neurotransmitter, right? The neurotransmitter is required for sending the impulses from one neuron to the another neuron. So the neurons which are releasing the neurotransmitter noradrenaline and cholinergic are your neurotransmitters, right? The neurotransmitter the neuron which is releasing the non-adrenaline as a noradrenaline as a neurotransmitter, that neuron would be called your adrenergic neuron. Okay, it's not necessary that it would be or myelinated or non-myelinated. Whether the neuron is myelinated or non-myelinated, if it is releasing the neurotransmitter from the synaptic vesicles, that is adrenergic, then it would be called your noradrenaline nerve fiber, right? And the nerve fiber or the neuron which is releasing the acetylcholine as a neurotransmitter, then it would be called your cholinergic nerve fiber or cholinergic neuron, right? This is your fifth classification of the nerve fiber. And if we talk about the last classification, that is your depending upon the diameter and conduction of the velocity impulse. Let me make you understand with the new slide. Yes. So if we're talking about the diameter and conduction of impulse, this is another classification, right? So if we are classifying on the basis of diameter and conduction of impulse, we have the classification that is type A fibers, your type B fibers, and your type C fibers, right? And if we are talking about the type A fiber, then type A fiber will be classified again into your alpha, your beta, your gamma. Let me write it properly, and your delta, right? So this is your type A alpha fiber, type A beta fiber, type A gamma fiber, and type A delta fiber. So how they are classified means we have the three types of classification, and further A fibers are classified into four types. If we talk about the diameter and conduction of impulse, right? So let's take first the diameter. What do you mean by the diameter? Diameter is nothing but the thickness of the nerve, right? So diameter is the thickness of the nerve, means how much the nerve is thicker, right? That is called its diameter. For example, the nerve is nerve thickness is this only, right? This much only. So its diameter would be this one only, na? This much only, right? For example, if the diameter of the nerve is this much, so let me make it clear. For example, this is a one nerve whose diameter is this, and this is another one whose diameter is this, right? So you now understand it is thinner than this, so its diameter is less, and it is thicker than this, so its diameter is more. So diameter is nothing but it's the thickness of the nerve, right? So how much the nerve is thicker, that is the diameter of the nerve. So if we are talking about the diameter of the nerve and conduction of the impulse, then we will talk about the conduction of the impulse later. Let's concentrate first on the diameter, right? So you understand what is the diameter? So it's the thickness of the nerve, right? And if we talk about the conduction of the impulse, if the conduction of the impulse is nothing but it is the speed or the velocity of the impulse that travels from one neuron to the another neuron, or that is traveling within the neuron, right? That is the conduction of the impulse, means its velocity, that with how much speed it is moving, right? That is also depending upon the thickness. So what is the relation of it? Let me tell you. Thickness, or you can say diameter of the nerve, it is directly proportional to the velocity of the nerve, right? So it is directly proportional to the velocity of the nerve. What does it means? It means that if the nerve is thicker, right? If the nerve is thicker, then its velocity would be also high, right? And if the diameter is less, then the velocity will also be less, because it is directly proportional, na? One thing if it is increasing, the another thing is also directly increasing, because they are directly proportional. And if the diameter is less, the velocity would also be less. You understand this concept? Now let me tell you that type A fibers are the fibers which has the largest diameter compared to these fibers. And if we follow the type B fibers, they have the diameter which is less than the type A fibers. And if we talk about the C fibers, it has the least diameter. Means they have the smallest diameter compared to the type A and type B fibers, right? And if we talk about the type A alpha, beta, gamma, and delta, type A alpha fiber is the maximum diameter, right? So you know that the if the diameter is more, the conduction of velocity will also be more. If the diameter is less, the conduction of the velocity will also be less, right? So if we talk about let me tell you one more thing here. Let me add it, that type A fibers and type B fibers, irrespective of alpha, beta, gamma, and delta, type A and type B fibers are myelinated fibers. Only type C fibers are non-myelinated, right? Type C fibers are non-myelinated fibers, and these type A and type B fibers are myelinated fibers. Got it? So these are the your classification of the nerve fibers. We have the six. Let's revise it very fast. The first one is your depending upon the structure, which has the myelinated and non-myelinated. Then depending upon the distribution, means to whom it supplies, that we have the uh, somatic and your visceral, means somatic are supplying to your skeletal muscle and visceral is supplying to your internal organs, right? Then if we talk about the function, that it will be sensory and motor, because its function is that sensory nerves are taking the information or sensation from different parts of the body to the brain, and the motor is taking the information from the brain to different parts of the body. If we talk about the fourth distribution, that is your origin, means from where the nerves arises, that is your cranial and your. So depending upon the origin, the nerve fibers are classified into the cranial nerves and your spinal nerves. What does they mean? You know that the nerves which arise from your brain, that is called your cranial nerves, and the nerves which arise from the spinal cord, that is called your spinal nerves, right? We have these four classification. If we go to the fifth classification, that is the depending upon the secretion of neurotransmitter, that is we if the neurotransmitter is secreted by the neuron, that is acetylcholine, then the nerve fiber, it would be called your cholinergic nerve fiber. And if the neurotransmitter is released the noradrenergic by the or the noradrenaline by the neuron, then it would be called your adrenergic nerve fiber. And if you go to the next classification, that is depending upon the diameter and conduction of velocity, you know that the diameter and conduction of the velocity are directly proportional, means if the nerve fiber is thicker or the has the more diameter, then its conduction of impulse will also be higher. So we have the three fibers type A, B, and C, and the type A fibers are again classified into the alpha, beta, delta, and gamma, and these have the thickness. Type A fiber has alpha fiber has the largest thickness, so the conduction would be higher. And type A and type B fibers are myelinated fibers, and the type C fiber is non-myelinated nerve fiber. Now let me show you one thing, that these are the diameters. You don't need have to learn this, but you can compare it, that type A alpha fiber has the largest diameter of the 24 micron, and type A beta fiber has a 12 micron, type A gamma fiber has a 5 to 6 diameter, type A delta has a 5 diameter, type B are 1 to 2, and type C are less than 1.5, right? According to its conduction of velocity, they will also varies, means the diameter if is having the largest diameter is of A alpha fiber, so the conduction would be also the conduction of impulse, means the largest the diameter, faster will be the velocity, means the conduction of impulse would be faster in A alpha fiber and compared to the C fiber, right? You can see this, largest the diameter, largest will be the conduction. Smallest the diameter, smallest will be the conduction. And type C fibers, only type C fibers are non-myelinated. Remember that. So with this, the classification of nerve fibers is completed. If you have any doubts, post in the comment section. And if you want to know anything else, or you want to you want to tell me that I should make the video on some topic that is not getting to you, let me post in the comment section. I'll try to make it. Thank you so much. Please watch my video and share it. Thank you.